Welcome to your 4state.com's Medical Corner. I'm Sajatha Khandelwal. Right now we're joined by Dr. Dan Michaels of the Reconstructive Foot and Ankle Institute, and he's our specialist on foot and ankle conditions. Nice to have you, Dr. Michaels.
Thank you for having me.
Our first question for you is, what is peroneal tendonitis?
Well, the peroneal tendons are on the outside of the foot, and here's a foot model, and they go around, down from the leg, around the outside of the ankle, and they insert on the foot, and they pull. They pull the foot out. So that balances the tendons on the inside of the foot, so you have a nice balance. But there's two of these tendons, and tendonitis refers to inflammation. Sometimes they're inflamed. Tendinopathy refers to degeneration. Sometimes that happens. Consider a tendon kind of like a bag of spaghetti, and it's made up of all these long segments. And sometimes when you sprain your ankle, you get a tear in one of these tendons, a longitudinal split tear. So it's essentially kind of like you took your bag of spaghetti and you took half in one hand and half in the other and you pulled it apart. And that's kind of how a tendon tears. It doesn't rip in half like two ends. It rips longitudinally like you're pulling the two bags of spaghetti apart, so you have an opening in the middle. And so when you get a split tear like that on the tendon, it causes a lot of pain on the outside. And
how do you treat peroneal tendonitis?
Well, because these tendons do one thing. They pull up and they move the foot out. You can control the pull on these tendons using conservative means. Using a good supportive shoe and not wearing flip-flops would be one way to go. When you wear flip-flops, your tendons are trying to support your foot. When you wear good supportive shoes, your tendons don't have to work so hard, and the shoe is doing some of the work. Now, add to that good shoe a custom-made orthotic, and that gives you even more support, and so the tendons have to work even less hard. Now, if those things don't work to relieve the pain, then an ankle-foot orthotic or an ankle brace can be beneficial, and that can help take away some of the pain. But after doing all these conservative treatments, if you don't get better, then sometimes you'll have to have surgery. And if you have, for example, a split tear on one of those tendons, we can go back in, and when it gets split, it gets like a flat piece of linguine, basically, instead of a piece of spaghetti. You want it round, not flat. And if you take your piece of linguine and you roll that over and you stitch it together, you'll make it nice and round again, and that takes away your pain. So sometimes that's what has to be done to take away the pain. But usually about 90% of the time, people get better with peroneal dysfunction by utilizing some of the conservative treatments. Now, one other way that things can go wrong with these tendons is that they can pop around this outside ankle. And so instead of staying behind it, they pop around it. There's not a lot you can do conservatively for that. That's more of a surgical problem, and these things have to be brought back behind and sewed in place. But for most other problems, and this is a very rare condition actually, but for most other problems with the tendons, conservative means usually takes care of it. Good shoes, orthotics, and bracing.
Certainly some good information there. Thank you, Dr. Michaels. Again, that was Dr. Dan Michaels of the Reconstructive Foot and Ankle Institute. And don't forget, you can find more information on foot and ankle conditions only here on your 4state.com.